Pulaski Memorial Hospital in Indiana has been working to reduce their total patient harm rate.
My name is Linda Webb, and I'm the Chief Nurse Executive at Pulaski Memorial Hospital in Winamac, Indiana. Pulaski Memorial Hospital is a small rural facility or critical access, and some of the defining moments that we have, our volumes are low. So when we look at our initiatives, so if we have one event, it really, I don't want to say skews the data, but it really kind of spikes up. So we worked really hard at adverse drug events and decreasing patient harm through the use of Coumadin. And when we went almost 2 years with having any type of event, and when we had one event, even though we were following our protocols, everyone was looking at that. How could we have done anything differently? But we were following the protocols, but there was no patient harm, even though their lab values exceeded what the criteria was. Being involved in the HEN with the support of the Indiana Hospital Association for our Coalition of Care, at the hospital we looked at a lot of initiatives, a lot of processes. With involvement in the HEN, we're looking at those outcomes. So it really connects the dots for our staff, and not only our staff, but our medical staff and our board. So we implement processes, and then what are those outcomes? The efforts that we've done in those processes, what is the true outcome for our patients? And so that's really been an exciting aha for us. How do we personalize our outcomes? Again, being a small facility, when we're reporting, say, patient falls or pressure ulcers, when we say one, we don't do it in a percentage. It's one patient who fell. Maybe they didn't have an injury, but still, it's that patient who fell that had a potential for injury. So we personalize it. Again, we're taking care of our friends, our neighbors, our family members in a small rural community. So we need to do the right thing every time for them. The engagement of patient family is just something new for us. We started with a council looking at our discharge process. So we developed a new discharge folder. We got their input on what's going to be valuable for them. And really, when we hear what's important to them, what makes sense to them, because we can sit in the hospital and make all these decisions, but in the end, is it really going to be helpful for our patient? Is it going to accomplish what we want it to accomplish with decreasing readmissions, making sure they have the information they need when they go home? The advice for others, it's one of the things in being involved with the HEN, it's if you don't measure it, you really can't fix it. So making sure that you're looking at the right things, the things that make a difference, and looking at those outcomes. Communication with your staff and getting medical staff, input from the get-go, and especially with the patients and their families, what's important to them.